Zambia Association of Gynaecologists and Obstetricians is the professional associations of doctors that specialize in maternal and newborn care. Our main vision as ZAGO is to ensure that women and newborn get the highest standard of care so that they lead very optimal health lives. We were formed in 2005, and down the line, this is 2022, we have been largely involved in the addressing of the high maternal and perinatal mortality. Zambia's current maternal mortality is 278 per 100,000 live births. This still remains unacceptably high. We are coming from a maternal mortality of about 729 in 2002, that is 20 years ago. So we've brought this figure down to 278, a reduction of about 60%. For perinatal mortality, we are currently talking of 33 per 1,000 pregnancies of perinatal deaths, but more in the neonatal mortality, which is also standing at 27 per 1,000 live births, still unacceptably high. What are we doing to address the problem? Firstly, ZAGO has been very instrumental in emergency obstetric neonatal care, EMOC, which we have successfully rolled out in all the 10 provinces of Zambia. And the ZAGO members have been involved in the training of midwives, clinical officers, general doctors in emergency obstetric and neonatal care. We have also been heavily involved in setting up of triage and high dependent units to care for the critically ill obstetrics patients. We have also been involved in the drafting and eventual launch of the referral guidelines, which spell out the pre-referral management, the communication, identification of high-risk obstetric patients for onwards referral to the next level of care. We have equally been involved in the design and development of clinical protocols on the common obstetric emergencies like postpartum hemorrhage, eclampsia, newborn resuscitation, infection prevention, and the use of the pantograph for monitoring of labor. ZAGO has been also instrumental in the review of maternal deaths and perinatal deaths, which is done weekly, and these identify gaps and come out with remedial measures to address the maternal mortality to avoid a repeat maternal or perinatal death. Other than that, through the Ministry of Health, we've provided leadership at all levels in fighting maternal and perinatal mortality. I would say that as an association, we have also been involved in evidence-based research aimed at finding lasting solution to maternal mortality, the preventable mortality especially, so that our target to reduce maternal mortality to less than 70 by 2030, and the neonatal mortality to reduce it to less than 10 in 2030.
ZAGO has been running the project dubbed the Zambia Prevention of Unsafe Abortions project. The project that we started to implement basically was to raise awareness on the magnitude of the problem of unsafe abortions in the country. We also were trying to raise awareness that abortion services are available in health facilities. The project had 5 pathways. Number 1, to look at how can the management and organizational capacities of ZAGO be enhanced The number 2 was trying to strengthen the networks with other like-minded partners to advocate for elimination of unsafe abortions in the country. The number 3, we are trying to look at how do we create acceptance of safe abortion services among the healthcare providers, but also the users of the service, the general public. The number 4, the project was trying to look at increasing communication and sensitization on the existing legal frameworks and guidelines pertaining to safe abortions in the country. The number 5 aspect was that we are trying to see how do we generate data and use evidence for policy influence with regards to sexual reproductive health and rights, including safe abortions. This project had a number of stakeholders that we were working with. We identified healthcare providers. So a cross-section of obstetricians, the medical officers, the medical licentiates, the clinical officers, the midwives, the nurses, all these healthcare providers that attend to a woman. We had to bring them on board, work with them. We are working with a number of youth groups, and so we had to identify some youth groups across the country. We also had interactions with the traditional leadership, the chiefs. We also had to work with the traditional marriage counselors, we worked with the traditional healers, we worked with the teachers, we worked with the police officers, we worked with the nurse tutors, and all these stakeholders were identified because we realized that to win this war against unsafe abortions, we needed a multi-sectoral approach. This is one successful project, and when you look at the other pathways, like pathway number 3, increased acceptance of safe abortion services, we've noticed that in the health facilities, the number of complications arising from unsafe abortions being attended to by our healthcare providers has drastically reduced. Why? Because our women, our girls are no longer going to the traditional healers, they are no longer going to Chimbusa, they are no longer doing termination of pregnancies using illegal and unsafe methods. The cases have actually dropped from around 30% to about 7% maternal deaths attributable to unsafe abortion.
We conducted a study within Lusaka and Copperbelt provinces of Zambia, some of the highly populated provinces. Some of the findings are that we still have a problem with unsafe abortions. Of course, our population was that of women who were seeking post-abortion care, and we found that about 30% of those had actually reported that their abortions were unsafe. And by this, I mean that that abortion was either done by a person who's not qualified or in an environment that was not safe for that termination of pregnancy to take place. So this evidence is very important in making policy moving forward on how unwanted pregnancies could be prevented. Because we found that women from the Copperbelt and those who had unwanted pregnancies or those who were single were more likely to conduct these unsafe terminations, which is a health risk. And we've seen that there are high mortality rates that are associated with these unsafe abortions. This data that is being developed now, the data that we have come up with, how can it be implemented to safeguard the lives of women and adolescent girls?
My reporting on sexual reproductive and healthy rights has been enhanced. I've changed the perception that I had and come to an understanding that we need to make these services available, because one thing is a fact, we can't run away from the truth that young people out there, adolescents, are engaging in sex. So we shouldn't bury our heads in the sand. We need to promote access to sexual and reproductive healthy rights for young people. If we just sit idly by and watch, we're going to lose a lot of our young men that are needed to provide workforce and productivity for the development of this country. So I'm proud to be part of this program because I'm giving the right information and knowledge out there.
From a journalist point of view, I think for me, this project is very relevant. It's relevant in that I think for a long time there have been concerns about unsafe abortions out there in the communities. And mostly this has been because of lack of information and even just the experiences that people go through when they visit a health facility. You know, sometimes they feel going for an abortion at a health facility is not going to help, it's going to expose them, and you know, so they would rather go for illegal abortions. And I think this project by ZAGO really, from my observations, has been helpful in taking out the correct information and also just talking about the dangers of abortion, like illegal abortions or unsafe abortions. I was doing a program and I could see the feedback from people. My perception has changed. Initially, I was thinking that, you know, there's this, because of the society that I grew up in, there's this stigma that goes with people that have aborted, and the moment you know that this person aborted, you know, you begin to look at them in a certain way. But then I think this program, this project has changed that perception, because I realize there are so many reasons that somebody would want an abortion, and it is not all the time that somebody undergoes an abortion because they are promiscuous, they didn't know what they were doing. There are a whole lot of reasons out there that are justifiable. My reporting, it has changed in that I'm reporting first of all from an informed perspective. My understanding is not just that somebody did an abortion because they were promiscuous, because it is their fault or something. I'm writing stories on abortion from a more informed point of view, as in what may lead somebody to undergo abortion, and the need to ensure that people who undergo abortion are treated just the same way, you know, like everyone.
We understood better after someone like gynecologists, obstetricians, that area to be specific, came to talk to us, and I feel we were understanding better now, because those days we would just hear, no, don't do this, don't do this, don't do that. Because most of the people we would interact with in the communities would, you know, do abortions without the medical aspect traditionally. But then now, after bringing it into the open, people are now able to go to the clinic. So I feel it's a term. I'm able to talk to young people about abortion and also convince the older generation. This time I can go with information I got from ZAGO. I'll go read something to them, explain it to them, though it's difficult to convince them. But here and there, at least they are adjusting.
This campaign came at the right time. It made us to realize on how we can able to work on our sexual reproductive health and rights as young people. Coming from a community-based organization, which is ZAGO in Zambia, the majority of our members are very sensitized about safe and safe abortion. One of its area of focus is sexual reproductive health and rights. We are working with the World Development Committee offices. Yeah, we are working with the zone leaders, not to forget the office of our area council.
We have a lot of high teenage pregnancy in this compound and in these communities where we come from, and a lot of them have lost their lives trying to do methods that are not safe. And I'm proud that our organization, Zukacholinga Youth Zambia, was part of the people that disseminated the information in the community of Garden Compound with regards to saving lives and how these young people can avoid certain methods and use and get information that will help save their lives. It is an honor, and it was very nice being part of the Safe Choices campaign, which actually gave us more opportunities to interact with young people at that level. Moving forward, we should be able to find ways of translating those laws to a very to a way that even a layman can understand and be able to use them and be able to know what the rights are. Because when we went in sensitizing in this community, certain people started realizing that someone denying them access to contraceptive was a crime, was against their rights.
My name is Aaron Mwate. ZAGO comprises with the young people like me. In my community where I'm coming from, we are doing community sensitization.
My name is Cecilia Katungu, ZAGO Youth Advocate in Kafue.
I'm Chinomunga from Choma, the southern province of Zambia.
Hi, this is Consilia, and I came to section reproductive rights advocate from Monze district, southern province.
My name is Advocacy. I'm a proud youth and ZAGO advocate from Mufira in the Kabaroad province.
I'm Freddy Zulu, ZAGO advocate from Kabwe Central Province.
My name is Arita Pere, ZAGO youth advocate, Chupata Eastern Province.
My name is Mesu Malabo.
I'm Natasha Msonda, youth advocate.